That was lovely. I really appreciate that. And thanks, of course, to Sash Bear and Lynn and Mike and all the people that came together today to make this happen once again. 10 years is really amazing. I want to talk just for a couple of minutes about our community together and how, as a community of people interacting around borderline personality and related problems, how stigma affects us and what we can do to stop the perpetuation of stigma and shame. Because stigma at the large social level is felt by people with BPD and people who love them as shame. So I want to just put a slide up just to start the conversation. So basically, the idea is that, as everybody here knows, everything starts with some sort of mental health crisis. And when that happens, a bunch of things start to unroll. And I think this is one way to think about it. So if we start here, the first thing that happens in a mental health crisis is that people in the larger community, our family, other family members, teachers, neighbors, and honestly, many mental health professionals become very judgmental, and they don't understand the nature of suicidality, the nature of borderline personality disorder, and become invalidating. The cumulative nature of judgments, misunderstanding, fear, and invalidation, that's what stigma is. By people who don't understand and are looking in from the outside, often with not only gross misunderstanding, but fear. So they don't understand. This, of course, creates shame. It creates shame for people who are struggling with BPD, suicidality, and other related problems. And it creates that same sense of shame in loved ones, in parents and partners and other people who love somebody who's struggling. The trouble is that shame as an emotion has an action urge associated with it, which tells us to hide. Shame is a social emotion. And so when we hide, we shut down, we withdraw from the larger social community, then we're not connected and we don't seek help in this mental health crisis, maybe bare knuckle our ways through it. But of course, without sufficient amounts of help, without support, the situation doesn't really get resolved. And sooner or later, emotions escalate, situations get worse, and we find ourselves in another mental health crisis with severe distress. And then what I'm calling inaccurate expression. Inaccurate expression is saying, when someone asks you how your weekend was and you spent 12 hours in the psych ER, inaccurate expression is saying, it was okay. Inaccurate expression is saying nothing when we're suffering. That's not accurate. Inaccurate expression is saying, no, I'm not worried about it. It's all right, when we are worried about it. And of course, when we don't express ourselves accurately, people can't understand us. They can't support us. They can't validate us. They can't make us a casserole like they would if you were in the emergency room with a child or a partner who fell off a ladder or off a bicycle and needed a mended bone or was stuck in the ICU because of a heart attack for a few days. People would come to your aid, but mental health, not so much. So our job is to do exactly what we're doing today. And this is, of course, one of the many, many wonderful things about Sash Bear and about this walk is that it gets so many people out from hiding, saying, yes, this has been our experience. This is how you can understand it. There are ways to understand it. This is not, mental health problems are not something to be afraid of. People struggle and have pain. There are things to offer support to. And so here we are walking out of the shadows, decreasing misunderstanding, decreasing other people's judgments, because it's very hard to judge if you really understand something. And when we decrease misunderstanding and judgments, we also decrease fear. When we decrease fear, people can start to understand, and they can start to validate and support and be present. And this stigma just evaporates into thin air. So thank you to everybody who supports the Sash Bear Walk. All I can say is walk on, because when you walk on, you're getting rid of the stigma. And what a better life this will be every subsequent year here on out. So thanks very much, and absolutely walk on.